A quick disclaimer before we begin, the PEMF podcast does not contain any medical advice, and the content provided is for informational purposes only. If you have any health concerns, please visit a healthcare professional. So welcome back to the PEMF podcast. This is episode 5, and today I'm joined by Deborah.
Hello, everybody.
And Deborah, I'll give you the platform now if you can introduce yourself and if you just give us a little bit of background about yourself and maybe about what Restoring Health is.
Excellent. Well, thank you first for the opportunity. It's really exciting to be a part of this project and this podcast. So I am South African, as you can probably hear, and I studied a degree in biokinetics when I was still back in South Africa. That's an honours degree in orthopedic rehabilitation, and went through a very long journey in the UK before I could practice in my field again. So we had a 10-year stint of doing all sorts of other things. But then as soon as I was able to get my citizenship, I was able to start practicing as a biokineticist, but quickly realizing nobody knows what that is in the UK. So I decided to do sports remedial massage, which is where I first met Andy from NewMed. And Andy started to speak to me about incorporating pulsed electromagnetic field therapy into my business. And at first I thought he was a bit woo-woo because he was talking about grounding and frequencies. And I thought, here we go, we've got some tree hugging technology coming in. But because my background is in physiology, I looked into the science of it and was absolutely blown away. So our journey started then, must have been about 10 years ago. And I have been using PEMF in my clinic ever since. And Restoring Health is a well-being centre that's based in Sutton, and we do all kinds of therapies and different modalities, but mostly help people in pain. And pulsed electromagnetic fields have been a huge part of that.
Thanks a lot for that introduction. So you've told us kind of how you first discovered PEMF. Actually, we met at an exhibition, quite a local one. And it was quite a nice introduction to ourselves. And at the time we were selling our first PEMF mat, and you was intrigued, and we went from there. So that was a really good introduction. From that first mat that you bought from us, where has that gone from then? So how many devices do you have, and how do you use them at the moment?
Wow. Okay. So we've come a long way together. I started out with what was available at the time. I think we used a full body, very low intensity device that, to be honest, I wasn't expecting much from. But one of the first people that I trialed the mat out to was a lady that had fibromyalgia, and I was doing a 2-month trial, and after I think it was a week, she started to feel so different that she bought the first mat from us. So what we started out doing was mostly promoting units for home use, because with PEMF, if you're using a lower intensity, the importance is that the frequency is really often, you're using it every day. And I was absolutely blown away with the results. And then we purchased a number of other devices. So we've got OmniMax, we've got Biomags, we've got NeoRhythms, we've got most of the things that are on the NewMed website at the moment. But the game changer for me was when Andy and NewMed started to become involved with distributing high intensity devices. You can see one of those behind me, that is a Zimmer EmField Pro. And I've always knew that for people to trust a technology that they don't really understand very much about, it's very little was known at the time in the UK, it's quite important psychologically that they feel a result fairly quickly. And that's what the difference is with high intensity devices. You can get results almost immediately with some of them, depending on what you're treating. So since then, we've invested in an EmField Pro. We have a Curatron clinic device. We have the Hugo, the yellow box. Andy, remind me which one that's called. Not the intensity, but
that's the Hugo Pro. Yeah. So that
Hugo Pro. Yeah. So we've got those 3 really incredible devices, and the way that I use them, the application of the PEMF is very different depending on the client, their tolerance, and what it is we're treating. But that has been an absolute game changer. I fight with our physiotherapist for this model, because even though we've got quite a well-stocked clinic with PEMF. Everybody gets to hear about the EmField, and it's something that is in very high demand. It's been a joy to use.
Excellent. So picture this: one of your clients comes in, they've never heard of PMF before. What's their reaction? How do they respond to, right? Let me, how do you introduce it to them, and how do they respond?
So I'm assuming I'll take it right back to the conversation I would have with them prior to them even booking in for a PMF. So they may come in and something they know, soft tissue therapy, sports massage therapy, and I find something within the assessment that I realize they would respond very well to the PEMF. So the conversation would go something like, we've got this incredible device. It's very high tech and it works at a cellular level. And what I'm seeing, for example, if somebody's coming with low back pain, is I would say to them, it looks as though I would like to just check the balance between the muscles in the back chain of the fascia, because with your low back pain, I don't think your glutes are engaging, which is the big bum muscles. And I would say to them, this technology will be able to tell us that. So not only when we place it on you can we see whether there is actually power to the muscle, whether the strength is less, but we would be able to make sure that bilaterally those muscles are working similarly, because when certain muscles are switched off neurologically, then other muscles have to work harder. And in your case, what's happening is your lower back is taking strain because your glutes aren't engaging. So I would talk them through the benefits of muscle engagement, of increased blood flow, decrease in pain if it's a joint problem mostly, talk about oxygenation within the blood. So I'd go into quite a bit of detail so that people realize the very, very secure science behind this technology, that it's not just I'm sticking you on a machine and we're going to expect miracles. And then I would talk to them also about the results that I've had with other people.
Oh, so yeah, you talking about results that you have with other people. So who would you say? It's very hard to pin it down because PMF works for a number of different conditions. But say, for example, someone walks through your door and they say to you, "Right, I have this condition," and you guys offer a number of different treatments, different therapies at your practice. But one person comes in with a certain condition, and you go, "Right, bang, PMF. That is the silver bullet for you."
Yeah. You're asking which conditions those would be.
Yeah. If it's
Ah,
if
such
it's
a broad question. Okay. Um, Let me try and take a range. So anything that most of the disease states that we find in the body are due to us being in a chronic state of inflammation. So inflammation is kind of at the foundation of a lot of the pain and the discomfort and the disease process. So if somebody has a systemic condition, so for example, fibromyalgia, I would definitely recommend a low intensity PEMF for them. So what I would do for them, because it's tricky to try and come into the clinic, is I would trial a lower intensity mat. They take it home for a couple of weeks, see if they feel a difference, and encourage them to purchase that. So that's the spectrum where people won't cope with the higher intensity of PEMF. If somebody comes into me with any joint pain, I would put them on the EmField Pro. So anything that's inflamed, that's swollen, it decreases inflammation beautifully, helps with edema, so that's the swelling of the joint. At a lower intensity, it can help with bruising. There's so many things, Andy. It's such a difficult question, but usually the way that we work, because we're soft tissue therapists primarily, is we would look at the way muscles work together. So say, for example, somebody's come in with a shoulder complaint or rotator cuff injury. That would be an ideal situation for the EmField Pro, because we would then be able to see whether all of those muscles that form part of the rotator cuff are actually working in sync. And then we would, through the application, be able to decrease pain and increase range of motion after the first treatment. It's immediate, usually, unless we're dealing with a frozen shoulder, which is a completely different scenario. But there are so many things. So any joint pain, any muscular imbalance, anything that's caused by inflammation.
Oh, cool. Really good. So you mentioned the client that you had that had fibromyalgia, and she came and had a great response.
Yeah.
Do you have another example, maybe of one more client that you would say, have tried everything and came in to see you and was treated on the PMF and had a complete turnaround?
I tell you what, you need to look out for, we're doing a new promo video and we've embedded about 4 or 5 client testimonies because we have so many. But I think one of the biggest joys for me has been a gentleman who's a builder, and he'd had a back operation that didn't go quite right. For 10 years, he'd been taking 3 massive doses of pain medication every day. And basically just because of his job pushing through the pain, but very limited range of motion was affecting his whole livelihood. We did treatment, and after a couple of months, he literally, and still doesn't, I think I started working with him about 6 years ago, and still doesn't take pain medication. Still does a crazy job. He's in his late 50s, very, very physical. His back condition hasn't changed in that he still had the operation and all the complications of that, but we are completely managing his pain with no drugs.
Okay, excellent. Well, it's this really common story we get, with PMF. It's just, we find a lot of clients have complete life-changing scenarios with it. So
Yeah.
it's great to hear from professional side of things. So would you say PMF has improved therapies you offer before you discovered it? So that everything you was offering in your practice before now, then you discovered PMF. Does it have a benefit on those therapies?
Massively. So what we do as a company is when we say bespoke, it's a word that's bandied around a lot, but we really genuinely mean that from our heart. So we get a client that comes in, we do a full assessment on them, and then we draw from various resources. And we've got a lot of different things we can draw from, PMF being one of them. And what I find is that we then make what we call a personalized wellbeing journey. And PEMF inevitably becomes a part of most people's journey because it works incredibly well together with other treatment modalities. So whether it is the soft tissue therapy, we kind of combine that, the hands-on work with the PEMF and exercise prescription has been the 3 things that I find are dynamite in combination. So each of them is good on their own, but when you start to combine therapies and have it as part of a healing process, it really comes into its own.
Okay, cool. What would you say to anyone who's thinking about adding PMF to their clinic? So, someone's
With clinic,
yeah, thinking of adding it.
just do it. Just do it. It is incredible. It's a message we've got to get out there. Um, and I'm seeing so many people in a lot of pain, sometimes undiagnosed, sometimes things are going on that the medical staff can't quite work out what's happening. People are struggling, we know, with the pandemic and the situation that the medical fraternity is facing at the moment, with short staff, etc. It's taking a long time to get people having operations, having diagnoses, doing basic tests. And if at the very least this is something that can get people through until the point that they're able to deal with something, if something requires an operative procedure, or it will just help them manage their pain both pre-op, post-op, and also just lighten the load on the NHS a little bit, because we'll be able to help people with those minor musculoskeletal injuries without them needing to have drugs and operations, and there's always a place for that. I'm not anti that, but I think we really need to get the message out there. And the other thing is just educate yourself. There's so much information out there. I know that we've done some courses together. We kind of got 3 levels of a course. And if people are interested in purchasing this kind of equipment and the high intensity stuff, by all means, grab one of the courses, come and see me. We do a level 3, which is basically just coming and me sharing my knowledge with you on how it works, how I do things, why we choose one machine over another one in different situations. And it's just that really practical, hands-on, experiential understanding that I think is important, because it is a fairly new technology to the UK. And I know that NewMed has been really pioneering in opening the way for this, and we've learned a lot of things along the way, haven't we, Andy? So
Yeah.
I think just come, really willing to share the knowledge. It's a message that just needs to get out there. Just do it. I mean, that machine, the value of that, you can go and look on Andy's website, because sometimes the things fluctuate, so I don't know exactly what the value is today, but it is more than paid itself back, more than paid itself back. And it's enabled us to expand into areas that we maybe wouldn't have before. I have a physiotherapist working for me now, and she's been trained on the equipment even before she came to us. So, it fits with many different treatment modalities.
So last thing for me really, are you looking forward to the future of PMF? If there was a future in the UK or across many other countries where PMF was much more widely used and introduced into more professional settings, does that excite you?
That would be such a joy, because I think it's essential. And I think if it was more easily accessible, we could collectively, make the costings of it more manageable, um, and also just educate people. I think what we're facing a little bit in this country and many others is that because the NHS has been available with very little charge, we tend to kind of want solutions that are outside of ourselves. And the more that I'm in this business, the more that I realize that we really need to take responsibility for our own health and well-being, that we need to educate ourselves, we need to be proactive. And I think that's the key thing around the future for PMF in the UK, is that if we can change from being reactive and dealing with people in a crisis situation to being more proactive and helping people prevent themselves getting into those situations, then I think just the general health and well-being of the country will lift. I know that seems like a really big vision, but the way that I plan to tackle it is kind of from the bottom up rather than the top down. So the more people that we can influence around us, the more people that we can let know about PMF. I mean, I've got doctors that come and see me, and we've worked with other medical professionals. People are starting to get back to local surgeons, and they could be, oh, I didn't expect that healing to go so quickly, what have you been doing? So the message is getting out there, and I think everything that we can do to get behind that message is going to be really beneficial in the future.
Thank you so much. It's been an absolute pleasure having you on to our episode 5 of the podcast, and hopefully we'll
You're
have you
very
back
welcome.
again.
Lovely. Thanks, Andy. Thank you so much for the opportunity. Really appreciate working with you.
Thank you everyone for listening or watching this PEMF podcast number 5. If you've got any questions about PMF or if you want to know more, please visit the NewMed website or reach out to us directly. If you've got any comments about this podcast, please leave a comment underneath. And at one point, we're going to do a podcast where we're answering all those questions from everyone that we've accumulated over this time. As always, please leave us a 5-star review and we can bring these more to you.